After weeks of speculation, the FDA on Friday approved the rollout of a COVID booster vaccine shot.
11 yeses, 0 no's, and the ayes have it, and the recommendation is adopted.
But before you pick up your phone and try to book your next appointment, just know it's not approved for everyone, at least not right now, and is currently limited to the Pfizer and Moderna vaccines, and only patients with compromised immune systems.
Such patients make up less than 3% of the population.
Dr. Jeffrey Schneider is chief of hematology and oncology at NYU Langone Long Island Hospital and says focusing on that specific population is a smart move given the rising number of cases.
The 3% or less of the population that will be appropriate are those kinds of patients that are getting therapies that are known to suppress their immune system. Examples of that would be patients that have received a transplant.
Dr. Schneider adds some patients undergoing certain cancer treatments would also be eligible. The hyper-contagious Delta variant, a main driver of the decision to selectively roll out the third shot.
The first and foremost reason that the FDA went forward with this was to protect that vulnerable population from severe illness. They represent about half of the individuals who are now being admitted to the hospital with severe COVID infection.
On page 20 of the CDC's slide presentation of considerations for booster doses, the agency acknowledges limiting its eligibility is, quote, important to ensure global vaccine availability, as new variants could emerge from regions with low vaccine coverage and high community transmission. Ashley Castro says she works at a children's hospital and she's on board with an eventual countrywide rollout of booster shots, but not just yet.
I think it would be a good idea just to see how it goes with the immunocompromised first and then see if we have enough and extend it to the other population.
Supply.
Right, supply, exactly. Especially other countries, they're dealing with that as an issue right now, so definitely something to keep in mind.